Natural Health and Healing Show with one of New England's leading nutritionists, Mark Minkle. The show is brought to you by the Good Health Stores in Hanover and Quincy. Call Mark at 781-837-4900 with your health and nutrition questions. Now, here's Mark.
Good evening and welcome. Welcome, one and all, to the Natural Health and Healing Show. We have some, of course, interesting nutritional information for everybody out there. And, it's astounding. I don't think a week ever goes by in my work week that I don't have at least one patient, one person come in and share with me their dilemma regarding GERD, gastroesophageal reflux. So many people, 25 million of us, incredible, 25 million Americans presently suffering from GERD. And, the number of folks, of course, that have serious passing issues, episodic issues with digestion, with acidity. So many people having digestive problems because it seems that, the stress is so directly correlative with the digestive system. And, we're going to talk about this at great length this evening. And there's some absolutely remarkable natural supplements that you can purchase over the counter, of course, at the health food store, that will make a significant difference in no time flat. So we want to talk about that with you this evening. As we said, 25 million Americans suffering from chronic acid reflux or gastroesophageal reflux disease. And, make no mistake about it, it can indeed lead to some very serious complications. The constant presence of that refluxed acid in the esophagus can lead to conditions such as Barrett's esophagus, erosive esophagitis, esophageal strictures, and, yes, even esophageal cancer. And an issue that is continuing to trouble so very many of us. And an awful lot of people, of course, as we said a few moments ago, have that direct corollary between their stressful lifestyles and their digestive system. Many people who encounter tremendous amounts of stress. Some folks, of course, their cardiovascular system is directly affected with hypertension, etc. But an awful lot of folks are affected directly in that digestive tract and really experience the abdominal discomfort and the digestive problems that are associated with gastroesophageal reflux. And again, when you think about the fact that nearly 1 out of every 10 Americans is presently suffering, and the numbers are growing, folks. The numbers are growing. So it's really important for us to share, I think, this very vital information that will make a difference in many, many, many lives out there. GERD, of course, is occurring in many folks where the lower esophageal sphincter is, of course, located between the esophagus and the stomach. It's weakened, and it opens inappropriately, allows acidity and other stomach contents back into the esophagus, causing the irritation. Many of the symptoms, of course, include persistent sore throat, hoarseness, chronic cough, asthma, chest pain, feeling like there's a lump in the throat, and in some cases feeling like a heart attack is coming on. So very, very uncomfortable, very damaging to the lining of the esophagus, can cause a tremendous amount of pain and discomfort, and of course, not to mention, really make a mess out of the digestive system, an absolute mess out of the digestive system. So in some cases, of course, dietary changes are absolutely essential. Over the years, I've found a number of people who had very serious allergies to, for example, gluten, wheat products, maybe dairy products. Some of the primary allergens, there are 9 primary allergens, and that are commonly triggered in these digestive upsets in many, many cases. So by getting to the root of the problem, by eliminating the food allergies, many folks find great relief. That's a very important component to this issue. But it's extremely important also to know that the medications that are generally prescribed for these a lot of the proton-inducing agents, etc., the great purple pill that we've all been recently become more familiar with, is something that is not the only path to resolution here. There are natural approaches to resolution as well, and many of these natural medicines are extremely, extremely powerful, very, very effective, and yet very safe. So you don't have to worry about any kind of complications or side effects, any contraindications, safe medications, yet, as we said, very powerful, very effective. And we're going to discuss those a bit later in the broadcast. And the other thing we're going to talk about this evening, of course, is we're going to talk about a product that's really associated with gastroesophageal reflux. It's called gamma oryzanol. Gamma oryzanol, that's spelled Oryzanol. And it is a product that I'm extremely enthusiastic about. There's been a tremendous amount of research over in Japan, and this product has absolutely come on like gangbusters, actually helping many people with gastroesophageal reflux who have developed ulcers, to heal the stomach lining, to actually heal the ulcers. And now new studies, of course, from Japan are finding other very important healing potentials for gamma oryzanol. They're also finding that gamma oryzanol has been supportive of cholesterol issues, menopause issues, irritable bowel syndrome, energy, gastritis, as we mentioned, ulcers. So we're going to talk a great deal about gamma oryzanol this evening, and we're going to talk about gastroesophageal reflux. We're going to talk about your digestion and some of those very serious digestive issues that so many millions of Americans are dealing with these days. Stay right where you are.
Hi, this is Laura from Good Health. We're all about smart, simple nutrition. Let us help you keep your resolutions and achieve all your personal goals. Lose weight, feel better, and look your very best today. Thanks for listening to the Health and Healing Show. We hope to see you soon.
Right in our area, we are fortunate to have one of the top martial arts schools in the country, Personal Best Karate. Personal Best has been recognized for their community involvement, professional staff development, character building programs, and exciting educational curriculum. Personal Best stands at the top of their industry. 5 locations offering personalized professional instruction. Not sure if karate is right for you? At no obligation, the staff at Personal Best will guide you in a private introductory program to see if karate is indeed the right fit to help you achieve your goals and meet your needs. What does karate at Personal Best teach you? Character building, success habits, helps you get in shape, relieve stress, self-control, setting goals, and of course, self-defense. Personal Best's goal is to create successful, contributing members of society through the practice of the martial arts at Personal Best. Mr. Chris Rappold is, of course, the founder of Personal Best Karate. He tells me his greatest joy of all is to see the personal transformation in each and every student. Bring out your best with Personal Best Karate. Telephone number 508-285-5425. That's 508-285-5425. Locations in Norton, Foxborough, Southeaston, Franklin, and Taunton. That's Personal Best Karate. Alrighty, welcome back. And we've got Dottie on the line. Dottie, how are you? Hello. Larry, don't leave that board. We got a call rocking in here. Dottie, are you out there? Dottie.
Here.
There you are. I knew you were out there somewhere.
Yeah, we weren't connected.
Sometimes we got to go fishing.
Right.
How are you?
I'm doing good. But I have a son that has a cough. He's had it for many months. And he has terrible coughing spells, and cough medicine, nothing helps him. Especially if the breeze hits his chest, he gets coughing.
He obviously is not a smoker.
No.
Great. And has he been sick through the winter months?
I think way back he did have a touch of bronchitis.
And no antibiotics through the past winter?
I think they gave him antibiotics for the cough.
Okay.
The bronchitis, I should say.
All right. Well, again, sometimes what antibiotics will do in some cases is they will actually not completely get rid of the bacteria. In fact, antibiotics are sort of misnamed. They don't really kill bacteria. They strip the cell walls of bacteria. So when we have these unfriendly bacteria causing these irritations and these inflammatory responses in our breathing passages in our lungs, what will often happen is they won't be completely annihilated by an antibiotic. Sometimes a course of antibiotics isn't quite enough. Sometimes that'll actually make things worse because in some cases what they'll do is destroy both the good and the bad bacteria. And of course, if those bad bacteria are virulent, they end up reproducing and replenishing their numbers at an alarmingly quicker rate than your good protective bacteria do. So that's why we see children often, back in the doctor's office repeatedly in the antibiotic merry-go-round over and over and over. So we need to stabilize his immune system. I'll tell you a couple different things I would do. Number one, I think that whether it's a bacteria or a virus, because again, the other problem with antibiotics is what happens if somebody has a virus and you're on an antibiotic? Wrong medicine. That's going to weaken your immune system. Like we said, destroy your friendly bacteria and not touch the virus.
He gets a little phlegm when he coughs.
Okay. Here's what I'd say. I'd say that if he gets monolaurin, monolaurin, because monolaurin is antifungal, antibacterial, antiprotozoal, antiviral. It covers all those bases. So if you take a 600 milligram capsule of monolaurin 3-4 times a day, I think over a period of about 3 weeks, I think he'll make some really terrific headway. If at that point in time, 3 weeks later, he's still being bothered by this cough, then I want you to go to oreganol, O-R-E-G-A-N-O-L, oreganol. Take the drops. I want him to put 30 drops in a glass of water and take it twice a day.
Okay.
All right. So
that should do it.
First things first. We start with the monolaurin, as we said, 600 milligrams. Have him take 4 capsules a day. Give that 3 weeks. If he's still bothered, then we're going to go to the oreganol.
Oh, great. Oh, by the way, you haven't heard from Bob from Marshfield for a long time.
You're right.
He's on his way out. I think he's got Lou Gehrig's disease. He can't really talk or walk.
Oh, I'm very sorry to hear that. Our prayers are definitely with Bob and his family, and I'll say a prayer tonight.
Yeah, I figured you'd wonder where he was.
He's a terrific friend of the broadcast. He's been on this show a number of times, and a very fascinating guy, a great guy, a fun guy, and he'll be sorely missed if indeed you're correct about that. But my best to the family if he's not feeling well, and our best to him as well.
Okay, thank you very much.
Dottie, great to hear from you. Take care of yourself.
I will,
right.
Thank you.
Yep, bye-bye. All right, let's get back on point here. We've been talking about a really important issue, GERD, gastroesophageal reflux, digestive problems, indigestion, gastritis. 25 million Americans suffering from the problem. 75% of all asthmatics suffer from GERD. 75% of all asthmatics suffer from GERD. What does that tell you? If asthma is an inflammatory condition and GERD is an inflammatory condition, it tells you that inflammation is broad spectrum in the body, that everybody has the genetic potential to express inflammation in a variety of systems in the body, whether it's the lungs, whether it's the blood. Yes, there is such a thing as blood inflammation. That's what we call blood clotting factor problems. So virtually any part of your body, immune system, pulmonary system, cardiovascular system, can be confronted with the problem of inflammation. And it's the same inflammatory hormones in the body that trigger all inflammation, and it's a question of which of your systems is genetically the most vulnerable. So a great deal of inflammation is originated in the body by food. Okay, so when we think about egg yolks, we think about red meat, we think about dairy products, we think about peanuts, some of the primary protein staples that so many folks indulge in out there. Those are inflammatory foods. They trigger a fatty acid called arachidonic acid, and that acid will usher in assembly line activity in the hormonal system of the body that produces inflammation. So one of the things we always suggest if folks have GERD, folks have esophageal reflux, folks have the problem with their digestive system, this hyperacidosis, this very uncomfortable condition, this very painful condition, we suggest they avoid all the inflammatory foods. Again, the real telltale here is 75% of asthmatics suffer from GERD, from gastroesophageal reflux. Therefore, it's really an important clue. It's a biochemical clue that your GERD is really the result of inflammation. And it's expressing itself, of course, in the digestive system, which, again, so many folks are genetically inclined to. So very important to start the process off by what I call addition through subtraction. Prevent the problem. Okay? You want to basically take, if you're dealing with the condition of GERD, you want to take at least 2 or 3 weeks of strictly avoiding dairy. You can substitute it with soy-based dairy. Soy is actually an anti-inflammatory food. Anti-inflammatory. So dairy products are inflammatory. Soy dairy product substitutes are anti-inflammatory. Therefore, over a period of 2 to 3 weeks, make the switch. Peanut butter can be replaced by soy nut butter. Again, just for a period of 2 to 3 weeks, make the switch. Red meats, avoid them. Egg yolks, avoid them. Eat the egg whites or some form of egg beaters or something of that nature. But try to stay away from those foods because, again, they are inflammatory. And preventing the problem goes a long way at correcting the problem. Number 2, important to understand the manner in which stress affects gastroesophageal reflux. Reflux disease is greatly largely the result of stress. So when we think about stress, stress produces a very powerful acid bias, or a very strong tendency toward acidosis in the body. And when you and I are relaxed, we tend to be more alkaline. When we're stressed, we tend to be more acidic. So the objective here is to try to see if we can't have a positive effect on the amount of acidity that we produce. And again, I always describe to people that there is good acid and there is bad acid. Okay? Good acids are digestive enzymes. So when your body is producing enzymes that break your foods down, those are healthy, positive, good acids. The protease, the lipase, the amylase, breaking down the proteins, the carbs, and the fats. We have to have those catalysts. And that's exactly what they are. They're good acid catalysts. But the hypothalamus in the brain is the body's regulator. It's the Wizard of Oz. Okay? So the hypothalamus is being sort of summoned by the body to produce acids that are digestive. So every time you eat a meal, the body is actually appealing to the hypothalamus. Hey, are we allowed to produce these stomach acids to break our meal down? And the hypothalamus says, look, if you're already alkaline because you're not stressed, then I'm going to let you produce all these healthy, good acids. Go ahead, digest your meal. But it's also possible that your hypothalamus is going to say, nope, I'm not going to let you produce this flow of digestive acids. I understand you got to digest your foods, but I can't let you produce these good, healthy acids to break your foods down because you're already flooded with very dangerous stress acids. And I can only allow you to be so acidic. Okay? So a lot of folks are not going to digest their foods. A lot of folks are chronically stressed and therefore producing stress acids, not healthy digestive acids. Remember, you don't get to produce both, either or. So when folks are chronically acidic from stress, they're producing citric acid. It's a different citric acid than you're thinking about with regards to your orange juice. And they'll produce lactic acid and pyruvic acid, these fatigue acids, these stress acids, and these really negative, these really dangerous acids in the body are what keep you from producing your healthy digestive acids. All right? So once this process begins to establish itself and really starts to gain some traction, and becomes a chronic issue, you're starting to eat away tissues. This very dangerous, destructive acid in the body will start to wear your tissues out, start to break your tissues down, ultimately creating infection. Most folks are familiar with H. pylori bacteria. We've heard more and more about H. pylori in recent years. The bacteria, of course, that results from many of these very sickly acids that produce ulcers. And again, the H. pylori bacteria will intensify and worsen the state of ulcerative tissue in the stomach. So it's really important, if we're going to seek out a natural therapy for these digestive problems, we have to think about what we said earlier. Number one, You want to avoid inflammatory foods. Avoid red meat, avoid dairy, avoid egg yolks, avoid peanuts and peanut butter. Those 4 at least you got to avoid because, again, they're inflammatory. Number 2, we want to be careful about the amount of negative acids, bad acids that we produce in the body, because those bad acids will not allow us to produce good digestive acids, number 1. Number 2, they will erode our precious tissues. As they do, these tissues will become infected. As the tissues become infected, they become ulcerative, and again, the problem just snowballs. And it really does too. Leading, as we said, in many cases to very serious issues and potentially esophageal cancer. Okay? So we want to make sure that we put into check the avoidance of inflammatory foods. We also want to regulate our acidity levels on a day-to-day basis. Now, how do we do that? If I'm stressed out, okay, I'll avoid the peanuts, the red meat, the egg yolks, and the dairy, but if my life is profoundly stressed, how can I do anything about that? I can't just push a button and make it all go away, of course. But you've heard me talk on this broadcast on a number of occasions about exactly what I'd recommend. Number 1, I'd recommend liquid chlorophyll. Liquid chlorophyll. Chlorophyll is, of course, what we call plant blood. Produces hemoglobin, increases the circulation of oxygen, the venous speed of oxygen in the blood. So we want to take at least 1 to 2 tablespoons of liquid chlorophyll 3 times daily. 1 to 2 tablespoons of liquid chlorophyll 3 times daily. And that goes just fine in about 3 ounces of water. Some folks, in order to make it more palatable, and by the way, it's not really that difficult to get down. If someone if someone is a little bit squeamish, a little bit fussy about it, and does not like the taste of it, it's kind of like grassy water. Fine, put an ounce of juice in there just to kind of sweeten it up a tad. But nonetheless, 1 to 2 tablespoons of liquid chlorophyll in 3 ounces of water 3 times a day. And I would also recommend 1/4 teaspoon of baking soda in an ounce or 2 of water before bed at night. Folks often get worried about the fact that baking soda has sodium and they may have hypertension. Don't worry, it's only 35% sodium. Okay? You don't have to worry about that. You're only using 1/4 teaspoon anyway. But those 2 things, even during periods of peak stress that you just can't seem to get a handle on, will intervene and make all the difference that you need. All right? So number 1, we're going to avoid the 4 inflammatory foods that we keep talking about: the beef, the dairy, the egg yolks, and the peanuts. All right? Number 2, we want to cultivate an alkaline chemistry. The best way to do that is 1 to 2 tablespoons of liquid chlorophyll in 3 ounces of water 3 times a day, along with 1/4 teaspoon of baking soda and an ounce of water before bed. All right? Those 2 strategies are really the key to stabilizing your gastroesophageal reflux. Now, in some cases, after your pH is corrected, and by the way, how do you find out if you're actually getting the job done? We suggest you get down to Good Health Natural Foods and pick up the little urinary strips. They're little tapes, little urinary tapes. And we suggest that you keep track of your pH. It should be between 6.4 and 6.8. First morning's urine, 6.4 and 6.8. The range, of course, goes from 5.0 all the way up to 8.0. And 5.0 is just too acidic. All right? You're likely not going to be 8.0. You're going to be 5.0 if you suffer from this condition. If you're 5.0, you should check it at least 3 times a week. First morning's urine. Easy to do. Takes about a 30-second period. And record the numbers and date it so you can keep those trends. And over 2 to 3 weeks, you should start seeing the pH really climb up in more favorable directions. And that means you want to get up around 6.4, 6.8, as we said. And I'm sure you'll be able to do that very easily. And also make sure, of course, that you're getting your fair share of alkaline foods. Unfortunately, most people in this great nation are very acidic eaters. By that I mean that they're using a lot of bread products, a lot of meats, a lot of fatty meats, and a lot of sugars. And those 3 things in particular, the processed breads and cereals, meats, sugars, very, very acidic. The foods that are most alkaline, of course, you can probably figure it out if you don't already know. Fruits and veggies, very, very alkaline foods. So if the average person was getting their due of either 6 to 8 servings of fruits and veggies a day, big positive contribution coming from those foods at alkalizing your chemistry. So that's really, really important. And when we come back from this break, we're going to start talking about the very important 3 supplements that you can obtain over the counter at the health food store that are profound difference makers in this condition. So stay right where you are.
This is Catherine from Jarrow Formulas. We're happy to have continued our relationship with Mark Nicola in the Health and Healing Show, and we're happy to announce a new product from Jarrow Formulas called Jarrow Cell. We all know that as the body ages, it heals less rapidly and becomes frailer. Often the body is unable to process enough nutrients to repair weakening cartilage and protein fibers. A very important element in building and repairing your body is silicon. But unfortunately, as we grow, you may have difficulty absorbing adequate silicon from your diet. But now, thanks to a product called Jarrow Cell, you can be sure to get your share. Jarrow Cell can give you the silicon you need to support your bone health, bone mineral density, and in addition, Jarrow Cell strengthens and beautifies your hair, skin, and nails. Jarrow Cell is available now in a synergistic liquid formula that also includes boron and zinc. Ask for Jarrow Cell at your local health food stores. Or for more information, you can go to the Jarrow website, which is www.jarrow.com.
Hi, this is Laura from Good Health Natural Foods, proud sponsor of the Health and Healing Show. We're all about smart, simple, and affordable nutrition. Let our lifestyle consultants help you and your family keep your resolutions and achieve all your personal goals this year. Feel good and look your very best today. For everything natural, organic, and economical, it's Good Health Natural. Thanks for listening.
Alrighty, and you know who's on the air here, live and direct on the Natural Health and Healing Show, because it is, of course, 8:30 and it's Candida time.
Hello.
How are you?
Good, I'm doing well, thanks.
Good to see you.
Missed you guys last week, but I had a great time with the kids in Maine.
Where'd you go?
We went to Peaks Island.
Oh, nice.
It was really nice.
Good. And the kids, of course, enjoyed
We
themselves.
just, ran
Had a
free.
blast. Great.
It was a lot
Good.
of fun.
Well, you got to have those intermittent vacations to recharge the batteries for everybody. Kids need it too.
Oh, I know. My daughter went to her first concert last night, the Jonas Brothers.
All right.
It was so much fun to see her go off
I'll
with her
bet she
friends.
had a blast.
She did. It was a lot of fun.
Good. So what's happening at Good Health?
So Nick was here last week.
He was indeed. He did a great job.
So you got to spend time with your son.
It
and
was
I was
wonderful.
with my kids.
It was great.
That's great.
Loved having him on. Look forward to getting him back in here too.
Well, don't miss those great deals at Good Health. I love the flyers. Folks, I don't know if you know, you could go on to goodhealthnaturalfood.com, click on the June flyer, and print out exactly what I'm looking at. But I'll give you a little rundown of some of the things that are on there, because I just love the affordability right now with the time. It's really hard for people. But the Barleans, 100% organic flax oil.
Yep.
Were you talking about that with alkaline?
No, but it's a very powerful anti-inflammatory.
I looked that up.
We were talking about inflammation as part of this condition, so you're absolutely right on the mark that the Barleans flax oil is rich in alpha-linolenic acid, which is anti-inflammatory.
And that's only $6.99 for an 8-ounce, which is great because I have it and you could travel with it, which I think is cool.
Fantastic.
Country Life Daily Nutrition, 30 tabs, is only $16.99, which is a great deal.
Great.
Diane asked me to mention that one as well. The organic Acai?
Acai.
I thought I was going to say
Acai.
the gold juice. These amazing berries have traditionally been used to increase energy, vitality, and to promote overall healthy living.
They're very, very, very high in what they call ORAC factor.
ORAC.
Their antioxidants are absolutely very, very powerful. High numbers.
And that's spelled ACAI. So go up and
Acai.
It's really cool. I just need a little bit a day, and gives you a lot of energy.
You take an ounce or two a day.
The glucosamine.
Glucosamine
Liquid
controlled.
glucosamine. It's on sale. The Now brand.
That's for all your aches and pains.
$13.69 provides a fast and convenient way to replenish joint tissue and promote normal movement while protecting our healthy cartilage.
Just for what it's worth, I like the Country Life brand.
Do you?
Yep, great product.
Yeah, they do have the Country Life
I
brand.
had a patient come in about 10 years ago or so and said, what do you think of the glucosamine chondroitin? I said, I read all the studies. They're fairly impressive, but I really never ever seem to hear any great stories, anecdotal stories from patients.
Mm-hmm.
And he said, this patient at the time said, I found that I tried several different brands and never got anything happening with the stuff, but I tried the Country Life and within 3 weeks noticed a marked difference in my aches and pains.
Really?
So I said, okay, I'll recommend it to a couple people. This is like 10,000 people ago,
Mm-hmm.
And I'm telling you, about 90% of them, when they use this particular product, that specific brand, Country Life, MSM-GS, glucosamine sulfate, MSM-GS complex, use 2 a day, it works. It really
Arthritis
honestly works.
too?
Well, it's more for joint inflammation, and in some cases for the arthritis too. The degenerative arthritis that is really lacking some of that buffering. So it seems to really have a good formulation. Does this product? So Country Life MSM-GS is where I like to go.
Excellent. They also have a whole variety of healthy snacks. If you're taking off to the beach, you're doing that quick stuff, that bulk food stuff.
Right.
I always bring the kids in when we're on our way to the beach. They pick up what they need, and it's just great.
It is
so
great.
convenient.
It is great.
Too.
And when you fill them up on good stuff, that means
they're not running around crazy.
That's right.
So go check out the bulk item. I highly recommend it. Plus all the fresh produce.
Right.
Wonderful snack choices they have. I'll tell folks where they're located.
Well, wait. One more thing. We've been talking tonight about GERD, gastroesophageal reflux, and there are 3 products that we're going to mention, in just a few minutes. But they are all 3 available at Good Health Natural Foods.
Excellent. We're
going to talk about those in a minute. I just wanted to throw that in. Go ahead.
Go ahead. Do you want to tell them about it?
Well, one of them, of course, is Gamma Original. We talked about that earlier. GAMMAORYCANOL, Gamma Original. They have Source Naturals brand, 60 milligrams I recommend 2 a day. They also have DGL, which we're going to talk about, which is a form of licorice root. Okay, of course, and it's the kind of licorice root that has been altered so that it doesn't tweak your blood pressure at all. So it's perfectly safe, no contraindications, no warnings, etc. And also Uno di Gatto, which of course a lot of folks are familiar with. It's cat's claw, the herb cat's claw. Now, all 3 of these will actually kill the H. pylori bacteria. All 3 of these will heal the stomach lining. And to use them together with the recommendations that we're talking about this evening, folks are going to notice a dramatic improvement in their gastroesophageal reflux in 2 to 2.5, no more than 3 weeks.
Excellent.
So those products are available. We're going to talk about them in a moment. But Good Health Natural Foods is located where, Candida?
2 locations. Quincy, 1627 Hancock Street, right in Quincy, Mass. The phone number there, 617-773-4925. And then Hanover, right on Route 53 on Columbia Road, 219 Columbia Road in Hanover. And the phone number is 781-826-0808. For all things
natural, it's Good Health Natural Foods. That's a no-brainer.
We decided to switch roles.
We did. It was kind of fun.
Wasn't it? And don't forget their website where you can always find their flyers. It's goodhealthnaturalfoods.com.
Wonderful. What else you got going on?
I don't know. Should we tell folks that we're going to be planning a...
We don't have a date yet.
Well, we're going to be doing...
We're going to be...
Actually, email me some dates in October that you guys would like Mark to do a muscle testing seminar, and we'll go from there.
That's good. That's the way we'll do it. So
the email is mmammit@verizon.net. I've never given my email out. I used to love it in the past when we had an event and you had your phone in the studio and you gave the number and it started ringing right during the program. That was always kind of fun. We could monitor our effect immediately. Well, thank you so much. Thank you for having me.
Have a wonderful, wonderful Sunday night.
Thank you. You too. I'll see you after the show.
All right. Thank you.
We could make it together. The further from here, girl, the better. Where the air is fresh and clean.
Hi there, this is Mark Nicole, the Natural Health and Healing Show. I know that so many of you out there are passionate about the latest cutting-edge nutritional information, would like to go on to that next level. I'm proud to announce that our new natural health care offices in Cohasset are offering personalized nutritional consultations. At Santi Holistic Healing, you'll experience an informative, individualized nutritional consultation by one of my finest personally trained nutritional experts. Your consultant will test you for specific food allergies and supplements. Together, you will chart out a personalized, optimal nutritional roadmap that will detail your healthiest foods and nutritional supplements, even specific doses. If that's not enough, we also offer relaxing healing massage at Santi Holistic Healing. Whether it's nutritional consulting or healing massage that you're interested in, we at Santi Holistic Healing are prepared to give you the healing experience of a lifetime. Call us at 781-383-3393. That's 781-383-3393 for the healing experience of a lifetime.
This is Catherine from Jarrow Formulas. We're happy to have continued our relationship with Mark Nicola in the Health and Healing Show, and we're happy to announce a new product from Jarrow Formulas called Jarrow Cell. We all know that as the body ages, it heals less rapidly and becomes frailer. Often the body is unable to process enough nutrients to repair weakening cartilage and protein fibers. A very important element in building and repairing your body is silicone. But unfortunately, as we grow, you may have difficulty absorbing adequate silicone from your diet. But now, thanks to a product called Jarrow Cell, you can be sure to get your share. Jarrow Cell can give you the silicone you need to support your bone health, bone mineral density, and in addition, Jarrow Cell strengthens and beautifies your hair, skin, and nails. Jarrow Cell is available now in a synergistic liquid formula that also includes boron and zinc. Ask for Jarrow Cell at your local health food stores. Or for more information, you can go to the Jarrow website, which is www.jarrow.com.
Alrighty, welcome back in, and welcome back on topic. We've been trying to kind of settle everybody's stomach out there. 25 million of you out there that have problems with that very sensitive stomach lining and gastroesophageal reflux, a nasty, nasty, growing, unfortunately, problem. And we do certainly have some wonderful natural solutions. We've kind of given you the dietary skinny on it. And now we're going to talk a little bit about some of the solutions. And we've talked earlier in the broadcast about gamma orygenol. Gamma orygenol is a really important product here. It's basically a sterile ferulate, which is basically a rice bran oil. A rice bran oil. And it's been identified as an immunomodulator, a number of different studies. Again, if you really look at most of the studies on gamma orygenol, very impressive research that has surfaced from Japan. The Japanese have done a tremendous amount of research on it, but I have right here clinical data on a number of different studies, animal studies, regarding gamma orygenol. And again, what is it? It is rice bran oil. And as we pointed out, Good Health Natural Foods does have gamma orygenol in the form of Source Naturals, 60 milligrams. I recommend 2 a day, but let's talk about it. A number of different studies have indicated that not only is it clinically supportive of the healing process with GERD, so if folks have serious gastroesophageal problems, there's, again, very solid clinical data that indeed it does make a significant difference. It is rich in unsaturated fatty acids, omega-6s, triterpenes, the antioxidant triterpenes, phytosterols, tacotrienols, of course, the vitamin E. It inhibits gastric acid, and recent studies indicate that it, as we said a moment ago, it's an immunomodulator. Very powerful antioxidant complexes that act as free radical scavengers, inhibiting gastric acid. Also, hyperlipoproteins and cholesterol. So a lot of the new research is indicating that it's been supportive in a number of different cases regarding anxiety, cholesterol, gastroesophageal reflux and symptoms of menopause. So, this is a really remarkable product that you're going to find more and more information on. But just in terms of some of the clinical data that I brought in, the pharmacological data here, gamma orygenol has been proven effective to treat symptoms of menopause, such as hot flashes. In 40 patients experiencing aging syndromes, gamma orygenol administered lessened menopausal complaints. A report of patients given 300 milligrams of gamma orygenol daily found a 50% reduction in menopausal symptoms in 70% of the patients. A later study reported 85% improvement in symptoms with the same dosage. Again, studies indicating that very promising results regarding total cholesterol, triglycerides, and actually increasing the good cholesterol, the HDL, to patients given gamma orygenol. Let's see here. Total cholesterol and LDL levels were decreased in 20 patients with no side effects. And this is a recent study that was, again, in Japan of 24 patients. And another clinical trial involving 67 hyperlipidemic patients given 300 milligrams of gamma orygenol for 4 weeks found cholesterol levels decreased by a mean of 10%, decreasing from 222 to about 190. The mechanism of the gamma orygenol involves the increase of cholesterol conversion into bile acids, the increase in bile acid excretion, inhibition of cholesterol absorption. So again, interesting stuff here. We're talking about something that in recent years has been found to be very effective for gastroesophageal reflux and healing the stomach lining and actually helping to kill the H. pylori bacteria. Now we're finding that there are a number of other really important pharmacological data regarding animal studies that gamma orygenol, which is, of course, again, rice bran oil, is an immunomodulator, an antioxidant, a free radical scavenger, inhibits gastric acid, cholesterol, triglycerides, also menopause, anxiety. So there's some really astounding research coming out these days that seems to be singing the praises of gamma orygenol. Another interesting thing that I've found with gamma orygenol is that some of the dosing on it is 60, 50, 60, 70 milligrams. And some of the research doses are 300 to 600 milligrams. So it's quite a discrepancy between the common over-the-counter doses. But take heart, because much of the research indicates that it doesn't seem to matter. It doesn't seem to make a difference. In other words, whether somebody's using a low dose or a high dose, the same results, the same consistent results are exhibited. So you're going to find more and more of the 60 milligram variety out there these days. So anyway, I recommend if you do indeed have gastroesophageal reflux and you're trying to heal that stomach, I do suggest that you get out and get some gamma, G-A-M-M-A, orygenol, O-R-Y-Z-A-N-O-L, gamma orygenol. We're talking about Source Naturals brand at Good Health Natural Foods, 60 milligrams twice per day on an empty stomach. So one in the morning, one in the afternoon. Easy to get, inexpensive, and a remarkable product. Also, I wanted to talk a little bit tonight about Una de Gato. Una de Gato, which is an herb that is referred to as cat's claw. A lot of folks are familiar with it. And first really researched in the 1970s. There's a great researcher by the name of Klaus Keplinger who did a great deal of research in Europe throughout the 1970s on a number of different herbs. And he did a great deal of research. Additional research was done in Austria, Germany, England, Hungary, and Italy has shown the beneficial effects of Una de Gato in the treatments of cancer, genital herpes, systemic candidiasis, and AIDS. 6 alkaloids isolated from the plant root have been found to be significantly supportive of white blood cells as they attack, engulf, and digest harmful microorganisms or foreign matter, and assisting in the process of phagocytosis. So what we're talking about here is Una de Gato having the ability to stop viral infections in early stages, also ability to help patients kill the H. pylori bacteria. There's a number of different formulas out there that have been developed. I've seen a number of them in the health food store, developed specifically for GERD, for gastroesophageal reflux, stomach acidity, and the infection associated with ulcers as well. And a number of these have been formulated with cat's claw. And the cat's claw is a very powerful agent. I've used it many, many, many times. A lot of folks who do suffer from H. pylori and who do have the chronic issue of gastroesophageal reflux or very serious stomach acid problems. So Una Degato is a really remarkable herb that, again, will help with this condition. And again, available at Good Health Natural Foods. What else did you expect? You knew it was going to be available at Good Health Natural Foods. What do I recommend for dosage on cat's claw? Usually you can find anything from 3 to about 5, and I've even seen 600 milligram capsules. But I generally would suggest that you find a 500 milligram capsule of cat's claw, and that you think in terms of two 500 milligram capsules, one in the morning, one in the afternoon, taken on an empty stomach to go along with your 60 milligrams of gamma original twice a day. One of the other things, too, that I suggest is that people, I know Good Health Natural Foods is starting to carry the NutriClear, N-U-T-R-I, Clear, C-L-E-A-R. And NutriClear is a very, very powerful metabolic cleansing agent. And it's basically a protein that has been isolated and concentrated from rice, from brown rice. And it's really a meal replacement agent, and it's a metabolic cleansing agent so that folks who have the misfortune of having a number of different food allergies and have a digestive system that's really on the fritz, not able to really break foods down, and the problems with gastroesophageal reflux, etc., benefit absolutely immeasurably from having that first meal of the day, a shake, a NutriClear shake. I recommend 2 scoops of NutriClear. It's produced by a company called Biotics. So you want to basically get the NutriClear for this condition and take 2 scoops rather, first thing in the morning for breakfast. And what you're going to blend with it is rice milk. Okay, so about 10 ounces of rice milk, 2 scoops of NutriClear. There's your breakfast. That is a meal replacement. It's going to clean out that digestive tract. It's going to neutralize the worry and concern of any food intolerances, food allergies. Easy to digest, easy to assimilate, pre-digested. And again, what a simple way to really clean up the breakfast and to start the healing process of H. pylori and ulcers, as well as, like we said, gastroesophageal reflux. So we've talked about NutriClear. We've talked about the Gamma Original. We've also talked about Una Degato, or cat's claw. And the third thing, or the next thing we're going to talk about is DGL. DGL, which is basically licorice root. Now, a number of people over the years were concerned about the possibility of tweaking their blood pressure with something like licorice root, because licorice root can activate the adrenal hormones. Adrenaline, when you're on the top of that roller coaster looking down, getting that adrenaline rush, a lot of folks get a little bit nervous about that, but you don't have to be anymore, because the DGL is the D-glycyrrhizated. The D-glycyrrhizated, which means that it has had the adrenal trigger taken out of it. So it's not going to trigger that adrenaline. It's not going to trigger your blood pressure. It's going to leave it alone. So it's no longer contraindicated. DGL is the safe version of licorice root for folks. Don't have to worry about it at all. No contraindications, no worries, no concerns, no warnings. On the good side, DGL is a remarkable agent that indeed will help heal that stomach lining. And again, there's a tremendous amount of research that does indeed indicate that very fact, that folks looking to heal their stomach lining. I have an interesting little piece from www.bodyandfitness.com I'd like to share with you. Licorice, or the glabra, as it's called, has been used for over 3,000 years, making it one of the most widely used medicinal herbs in history. Licorice naturally contains 10 triterpenes, 22 different flavonoids, which are believed to be largely responsible for its benefits. Licorice has been used as a highly effective alternative to antacids and acid-blocking drugs. By comparison, licorice works not by inhibiting acid production, but rather through supporting and stimulating the stomach's natural protective mechanisms. Stomach discomfort is usually attributed to an imbalance between acid secretion and the stomach's ability to protect itself against the irritation caused by these dangerous acids. The presence of harmful bacteria can also be a factor. The stomach's primary defense against corrosive gastric acid is a fine layer of mucin, secreted by millions of mucosal cells that line the stomach wall. Licorice has been shown to stimulate both the secretion of mucin and the formation of new mucosal cells, probably through its ability to increase blood flow to mucosal tissue. In addition to supporting a normal chemical balance, licorice has been shown to help inhibit the growth of potentially harmful intestinal bacteria such as H. pylori. A double-blind, placebo-controlled trial that 16 people with significant stomach discomfort showed an average improvement of 78% when given 360 milligrams of DGL 3 times daily compared to 34% in the placebo group. Other trials have compared DGL to prescriptive drugs, showing that 760 milligrams of DGL 3 times a day is as effective as popular prescription drugs. So DGL is something that you can find at Good Health Natural Foods. You knew that. What kind of dose would I recommend for DGL? I'd recommend 350 milligrams or thereabouts twice a day. And ultimately, I think, depending on your degree of comfort with pill taking, you could go to 3 of those a day. So that's 350 milligrams, 2 to 3 a day. All right, and that's DGL. It's licorice, and licorice is really important, as we just found out just a moment ago here, by defending the stomach against corrosive gastric acid, by supporting and by building up the mucin levels and the mucosal cells that line the stomach wall, stimulating the secretion of mucin, formation of mucosal cells. So you want to basically make sure that you're taking at least 350 milligrams of DGL 2 to 3 times a day. These are really important factors. Now, there's some additional secondary issues that I might recommend too. There are amino acids that have proven very helpful for this condition. Histidine, Histidine, L-histidine, which means it's a free-form amino acid, and that would be 500 milligrams times 2, empty stomach on those. And again, L-histidine, Histidine, histidine. Also, glutamine, L-glutamine, Glutamine, 500 milligrams, and that's times 2 also. But again, here's the really interesting part of this equation. To take this approach, the approach that we've just sort of taken the time to highlight for you this evening, you will rid yourself of the problem and heal the stomach up. Okay, so you're not going to be dependent upon this process. You're not going to be dependent upon these supplements. That's a question that folks ask me all the time. When can I get off these, and when? How long do I have to take them for? First of all, the good news is you're not dependent upon these for the rest of your life. That's really important news, because we want to get you on your own independent immune functioning and digestive functioning systems. And that's exactly what these supplements will do. These supplements will allow you the opportunity over a period of about 60 days or so to really heal up these tissues, reverse the problem, and to put you back in a position to stabilize your own digestive processes. Now, obviously, it's conceivable that somebody gets back in the problem areas with stress and bad diet and may need to do a booster program. That's not unusual. But I think it's really important to realize that these things really work. There's great studies, a lot of subjective information. I've recommended these programs for years and watched them do their stuff. They are absolutely amazing. So, you don't have to suffer with a condition. And as you know, there's always an alternative. So that's what this is really all about. So I'm going to recap real quickly, I'm going to recap in just a minute here. Give you a real good, clear recap of exactly how you beat this problem of gastroesophageal reflux. Number one, remember we talked about food. It always starts with food. It begins and ends with food, of course, in my estimate. And number one, you want to avoid the inflammatory four foods. The four inflammatory foods. What are they? Do you remember what they are? Number one, you want to avoid dairy. Number two, red meat. Number three, you want to avoid yolks. Don't worry about the whites, but the yolks. And then number four, peanuts. You want to make sure you avoid dairy, red meat, yolks, and peanuts. Okay? Those are inflammatory foods, and at least for the period of time that you're really trying to create a positive healing effect for this condition, you really want to take the time to avoid those. Number two, a little bit more food information. You want to make sure that you stabilize your pH. The best way to do that is liquid chlorophyll. You want 1 to 2 tablespoons of liquid chlorophyll in 3 ounces of water 3 times a day. You also want to take 1/4 of a teaspoon of baking soda, 1/4 of a teaspoon of baking soda, 1 ounce of water before bed. And you want to take the time to actually look at your pH. You can purchase those pH strips at Good Health Natural Foods. You want your range to be 6.4 to 6.8. Any morning that you check out your urine and your pH is between 6.4 and 6.8, that is a morning where you're turning your condition around. You will not suffer from the condition if you can put enough mornings together with that kind of a number, those kind of numbers. 6.4 to 6.8. You want to stabilize that and check it. First morning's urine at least 2 to 3 times a week. All right. And then we talked about the natural supplements. The natural supplements, of course, we talked about this evening. Number one, we talked about gamma oryzanol, GAMMAORYZANOL. We're talking about 60 milligrams twice a day. We talked about Una de Gato, which is cat's claw as an herb, 500 milligrams twice a day. We talked about DGL, licorice, 350 milligrams twice a day. And for folks who don't mind giving it a try, the NutriClear, which is a protein meal replacement powder, 2 scoops, 10 ounces of rice milk. That's your breakfast. And you want to make sure the rest of the day's got a lot of fruits and vegetables and lean proteins, and that covers the bases pretty solidly. All right, somehow we got through this evening in a flash, per usual. Stay tuned for Dr. Julie Johnson. She'll be with you just a few moments here. And again, folks want to watch this broadcast, and you want to keep up with what we've been talking about on these broadcasts. You can check out our website, www.maxhealing.com. Our thanks goes out to Adam Ing for the wonderful tech response and getting things up and running on our website. And until next Sunday at 8 o'clock, this is Mark McCuller reminding you all, please be wise, be aware, be well, make it a healthy week. Good night.
The South Shore's first choice for live team coverage of breaking news, emergency traffic, and severe weather. 95.9 WA.